In one of his first acts after taking charge, US President Donald Trump reimposed the global gag rule denying American funding to foreign NGOs for abortions. So, how is this change going to impact NGOs working on abortion rights in India? WION's Dharvi Vaid has the story.
A change in Washington that is likely to directly hit women in rural India. Donald Trump's reimposition of the global gag rule cuts US funding for foreign NGOs working in the field of abortion rights. Even those that share information about or provide abortion counseling won't get financial aid now. Abortion is legal in India, with nearly 6.8 million abortions reported annually. But research suggests that 80% of women in India do not know their rights when it comes to abortion, leading to unsafe terminations of pregnancies.
Safe abortion access is restricted due to awareness and stigma. And now if you really look at the global gag rule, what does it do? It has a conditionality which does not allow, which is the Indian NGOs from talking about abortion or offering abortion services or even referring women to abortion services. So this would be a big barrier in moving this 5 million unsafe abortions to safer services.
According to the IPAS Development Foundation, 10 women die in India every day due to unsafe abortions, and more than 5 million women risk having unsafe abortions each year due to the lack of access to safe services. The Mexico City policy, or the global gag rule, was first introduced in 1984 and is a classic example of how domestic US politics affects the world. The rule is solely dependent on the inclination of the US president, repealed when a Democrat is in office and reinstated when a Republican comes to power. The last time it was revoked was under the Obama administration in 2009. That had meant 8 years of a robust funding to foreign NGOs. In 2015, United States Agency for International Development, USAID, a major source of US funding for healthcare in India, spent $21 million on family planning and reproductive health services in the country. Though the legal status of abortion allows the Indian government to spend on it, a large number of NGOs working in rural India are dependent on funding from the US.
The gag order is definitely touches upon the total subject of population and abortion-based activities. Definitely, if they are withdrawing from the support in this particular area, definitely awareness program is also part of the program on abortion actually. So definitely, even not only in the villages or in the urban areas also, it is going to affect.
And it's not just abortion services that are going to get affected. The cut in funding will also impact reproductive health, maternal and child health, and HIV-related services.
It's an infringement on our Indian context itself. In India, abortion is legal. In India, abortion is hugely needed. 8% of all maternal deaths happen due to abortion. And now when US decides that through their funding to inhibit Indian agencies from doing anything around abortion, in a way it completely restricts and is contrary to the Indian rules and philosophies.
Sub-Saharan Africa had reported a higher abortion rate the last time the gag rule was imposed under George W. Bush in 2001, because it reduced women's access to contraception. Advocacy groups fear that the gag rule this time will have an even worse impact, given that Trump has expanded its reach. Under Trump, the rule will apply to 15 times more funding than usual because it applies to all global health funding and not just family planning through USAID or the State Department. A complete stop after 8 years of funding will be a huge setback to several NGOs in India working to eradicate the taboo around abortion. On the flip side, it might push India to shell out more for safe abortions and abortion-related services. In New Delhi, Dharvi Vaid, WION.